Welcome to our broadcast, The Path to Be Well, Knowledge and Learning session. To all our listeners, we're so happy that you have joined us. And please note that you can subscribe on your YouTube channel or find us at weedwell.live. These sessions are focused on adding clarity regarding cannabis as a treatment option and whether or not it's right for you, and will bring clarity and help make informed decisions with respect to improving your quality of life. Now, you may know someone that could benefit from this type of information. So please do us and them a favor by sharing this event. My name is Mark Trombley, a founding member of Simcoe Holistic Health and Weedwell. I want to share with you how I became involved with cannabis as a medicine. As a teenager, I did sample marijuana and quickly concluded it just wasn't for me. I will admit, I did find myself judging those who did consume marijuana, thinking their sole motive was to get high. It wasn't until many years later that I discovered the true medical benefits of marijuana. A loved one was diagnosed with MS, and after many months of symptom manifestation resulting in sleepless nights, I witnessed firsthand just how cannabis can help alleviate symptoms and improve sleep. As a result, Simcoe Holistic Health opened its doors in 2013. And since then, we have served nearly 6,000 patients ranging from ages 3 to 93. I have personally witnessed countless individuals and families experience improved quality of life. Having said that, I've also observed that cannabis treatment is simply not for everyone. And for that reason, I want to caution all our listeners that cannabis treatment is not a one-size-fits-all. Determining if cannabis is an appropriate treatment requires the attention, care, and focus of your healthcare team. At Weedwell, we are committed to helping people improve their quality of life, and utilizing cannabis as a treatment option is one way to accomplish that. Joining me today is my colleague, Paul Calori. Paul, welcome.
Thanks, Mark. How are you today?
I'm doing good.
Excellent. So we have a new topic today we touched on last week. We'll be in our Be Informed section, and it's all about THC. And we're going to talk a little bit about the good things, as in what it's used for, some of the side effects that people might be familiar about or not familiar, and we'll see where our kind of outline conversation brings us. Last week with the CBD, we started with a little outline, and I think 40 minutes later we were still gabbing as the case may be, and it was a really nice conversation. We started with 2 or 3 things we would talk about, and it ended up being like 5 or 6 or 7. So we'll see what today brings.
Yeah, yes, indeed. And I'm actually looking forward to it, Paul. As you said, I've also thoroughly enjoyed last week. And it's amazing how 3 simple letters, CBD, how conversations can really, be generated from that. So I shared a story about a construction worker that was consuming enormous amounts of THC just to alleviate some of the pain so that he could continue to work. And upon trying CBD, with reluctance, I may add, he did report 3 months later that he had truly found a lot of relief with CBD regularly under the tongue in an oil format, and that he was very, very grateful for that for 2 reasons. One of them, actually 3, he felt so much better, able to fulfill his duties at work. He wasn't impaired, okay, because it was CBD, not THC. And he reported that he was actually saving significant amount of money from smoking a joint and it being THC. So that young man, 30-ish, for him, it was a breakthrough. And not that he used those words, but life-changing would probably be something that would come to mind.
Yeah, absolutely. And I started, we started, excuse me, the last week, just the evolution of CBD and how, like your construction worker example, this gentleman never heard of it before. And part of it, the education was just putting those letters in people's heads. And yes, the first time is, what are you talking about, old man? I think is what you mentioned last week. Your words, not mine. But when someone hears it 2 times or 3 times, and then over time maybe has a friend or a mate or someone that they hang out with at a various social gathering, they're using it, then all of a sudden it sticks in, and you're willing to give it a try. But what I would like to ask you about, over time, and since 2017, when I started doing some work in the clinic, I've seen an evolution in THC as well. And I wondered if you could share with the listeners and the viewers some of the things that you've maybe noticed over the years with how THC might have been approached with clients coming into the clinic in 2013, 14, and what have you, and now into 2021.
Yeah, absolutely, Paul. I'd be happy, and I think it's worthy of doing that for sure, and of value. Yeah, so back in 2013, 14, CBD was almost non-existent, not only in product, really in knowledge. Very few people knew of CBD, and honestly, I wasn't one of them prior to meeting my colleague, Doug Rawson, and then at the time, Dr. Adelberg. So, it was all THC. And I have to say that the people we were treating was different, a different age group, if you like. Many of them coming to see us were already self-medicating. So we know what that means. It's, it was a product that was non-CBD. So it was definitely a transition. And I think you touched on this last week, Paul, is that really Simcoe Holistic Health were truly forerunners in the CBD arena, shall we call it. In fact, as I mentioned, it's thanks to Doug Rawson and Dr. Adelberg that really enlightened me. And I'll never forget the first time that they prescribed or recommended CBD for a patient for a certain known condition that I, until that time, was always THC. I'm not sure that I ever shared this with Doug, but under my breath, I'm like, what the heck are they doing? I'm serious. Like, I remember that day when that happened. And I'm like, man, I think we need to, to revisit this. But to my amazement, I seen the transition. And forerunners, and I'm repeating myself from last week, but when we had licensed producers in Canada, the cultivators are called licensed producers. When they would come to us and say, we like what you're doing in your clinic, that whole patient-centric approach, that whole thing, how can we help you more? How can we provide better products for our patients? And the conversation was consistently the same: CBD, CBD, CBD. They truly did not get it, with the exception of maybe 1 or 2. They would take that information, bring it back to their decision makers back at head office. And it was really a transition. It took time for that to really materialize. Understanding, of course, that when you start growing CBD, there's a huge time lapse there of 90, 120 days from start to finish. But even putting that aside, just for the leaders in this industry in Canada, it took them a while to really get around that and support it. Again, there were some exceptions of those companies, but for the most part, pretty much naive when it came to CBD. So definitely a transition. Now, to your other question about how has it impacted THC, it's gone from, almost all THC consumers, and then it was a gradual transition over time to now the bulk of our patients are consuming CBD almost daily, perhaps twice a day. In the oil form is the most popular. It doesn't mean that they're not taking THC or that others are not treating only with THC, but by far CBD has taken the upper hand on that. And as you know, there's many cases, and migraine is a good example, where CBD twice a day will help, keep at bay the migraine episodes. But in the event of a non-set, that the best go to at that point for breakthrough is THC. Now I'm getting into your realm because you're the expert behind that. So I'll let you carry the ball from here, Paul.
Oh, it's our realm. Experience is experience. And when you're talking multiple years like yourself, I'm happy that you're sharing with the audience. And you know what? We've said it before with the interviews on other shows. We're always learning, and you've just pointed out exactly a time where you were learning and you were able to learn, and that's the best part with something new like this. Be open to learning. Couple of things that I've noticed over time with the THC or the person looking for THC, and please, anyone listening, don't take that in a negative way. There is a place for therapy and therapeutic treatment with THC. So, but I remember, I believe it was Jim in our interviews, and he did a ton of research before actually committing to the process. And one of the things was THC and causing mental health disorders specific to schizophrenia is what came up. And he wanted to do his research beforehand, before he got there. I guess what I'm saying is we have more discerning clients and consumers that they're not anti-THC, but, and to touch on a little bit of what you said, the people taking the CBD during the day, a lot of times is so they fit it into their life, whether it's kids or work or whatnot, and they find a way maybe in the evening when they don't have anything to do to involve THC that way. And that would be a huge change, from 2013, 14, but I would say I've seen that from 2017, 18 and onwards as well, where it's not all or none. It was all THC at one time, but as CBD becomes more prevalent, or we're finding more conditions that people are having success for, that doesn't mean THC goes away. It's just now we're finding clients and customers and patients and whatnot finding a way to use both, depending on their medical condition, depending on what their body is telling them. We've done previous shows on health journaling and titration and listening to your body. Well, all that's trialing and figuring out what works for you. So it's an excellent evolution. Thank you for giving us the onset of that. I think we're in a good place though, as the industry moves forward and whatnot. So THC, now I guess we should actually introduce it. Most people are familiar with this, tetrahydrocannabinol, which I always stumble over trying to get it out of my mouth. But most people are familiar with it because it's the substance in cannabis that makes you high or stoned or whatever word you would use. But we want to point out there's numerous therapeutic effects. So it's not just a method to feel happy or euphoric on a Friday night or Saturday night. There is actual therapeutic benefits to it. Mark, maybe you can share some of the common conditions or symptoms that our clients tend to gravitate towards THC in treating.
Yeah, for sure. Stress, anxiety is a common one. And for those patients, it can be a little, I'll call it risky, if you are not aware of the right strains that would work for you. And we've used sativas and indicas. We can use those terms loosely, but there are, suffice to say that some strains can actually, aggravate those conditions. But when the patient suffering from high stress and anxiety does find the right strain of THC, they find relief with that. Another very common one is for sleep. And then again, in general sense, most people respond better to a sativa generic strain, an indica for sleeping. Having said that, though, Paul, maybe there's a reason why I stumbled on that. I do remember a patient specifically looking for sleep aid. I'm going off on a tangent here, but just, I think, a benefit to our listeners. And we tried, the typical treatment plan. If there is such a thing as typical, they tend to be really customized to the patient, but a protocol that would resemble many of the others. And she exhausted all of those options without any relief for sleeping. On her own, she tried sativa dry, and she reported that she slept the best. She had the best night's sleep, and she continued down that path. So that's why when we say in general terms, we mean that there are some exceptions to that, as there are for so many other things and treatment and medication. And marijuana is no different than that. But for sleeping, indicas typically have worked for patients. And then for pain, obviously, there's theories that, THC will take your mind off the pain, and that distracts you from focusing on your pain, in addition to, the therapeutic effects directly targeted to the pain. I don't know if that's kind of what you were looking for, maybe a little bit more, maybe.
No, it was exactly what I was looking for. I think those are our common conditions of people that we see come into the clinic. So, some of the other ones that are interesting as far as studies go. So we're not there yet to say that it cures or anything like that, is the Alzheimer's and the studies with the plaque formation. We'll see where that goes as more studies come out that way. Some of the symptoms of ALS as well. And we'll see where that goes. But yeah, it tends to be the sleep pain group, if you will, that finds great relief with the THC. And, as you were talking there with the anxiety patient, we've used the term peeling back the layers of the onion quite a bit. And so it's interesting when the person gets control of that anxiety during the day. Sometimes they don't need the THC, or they find over time as the day is better, they need less medication, which is the THC, we would say, at night. And other times that's not the case, but it is quite interesting when they start peeling back the layers. And once you get, we talk about putting the brakes on, having a reset. Once you get control of one symptom, or maybe one or two symptoms, some of the other things tend to fall in place, even without cannabis or a pharmaceutical medication. Mm-hmm. So having said all that, I think, the obvious side effect, and I don't know even know if you could say side effect, it's really a common effect, is the euphoria or the high feeling. And, we see clients come into the clinic and they're automatically turned off of THC because of this. And it's hard to sometimes get through that you're actually withholding a treatment that may potentially be of benefit to you. Have you had these types of conversations, Mark, with clients?
Yeah, absolutely. It's fairly common, actually. And especially when you consider the dominant demographics of our clients, 55 plus. Now I would say it's almost 65 plus, where one of the first opening comments that they make when we communicate with them is, I don't want to get high. And if you think of the demographics, they lived through an era with marijuana and all of the, all of the negative comments related to and the stigma associated with that. So in fairness to that generation, they've lived through and, were exposed to it and made their own choices, one way or the other. So that now for medicinal purposes, one of the first comments that they will bring us is, but I don't want to get high. And when we talk about THC, if indeed it applies to that patient for sleep aid, we help them in that area by suggesting, Paul, to you?
CBD. We talked a little bit about this last week. We can definitely touch on it this week again. You started talking about that, and it wasn't even necessarily where I thought it was going. But you're 100% right. There is a time that there were a lot of derogatory terms for that person using marijuana wherever they were using, and that doesn't go away if that was you, even if you were just trying, as you've mentioned in your intro. I tried it. It wasn't for me. Other people tried it too, way back when, and they're now reintroduced to it in a medical sense, which totally wasn't their sense before. When they first tried it, it wasn't their sense before. But those things that might have been said or directed or put in the media, war on drugs, and kind of all those, they don't go away. Like, you just don't slice that part of your mind out. It's there. And so we see those biases because people have been fed it for 20, 30, 40, 50 years. And so when you brought that up, I think that's an excellent point. They don't go away. But to the second point, we tend to recommend some amount of CBD to help mitigate the effects, specifically the euphoric effects of the THC. And it's a way of dipping your toe in the water. And so along with the amount that we might suggest as a starting point in our start low and go slow mentality. So a very small amount of THC, but even with that small amount, recommend using some CBD to mitigate the effects. But they still will occur. It doesn't make them go away. But it's one of those, as every medication goes, risk to reward. And the risk is you might feel this way, but the reward is your pain might, or your sleep might be that much better, or what have you. But thanks for bringing up, kind of more the historical sense. I like that. I think it's a very, very important point. I think it was a great point.
Thanks, Paul. And now I'm going to step out a little bit, and I'm hoping that our audience have a little bit of a sense of humor, and if not, just dismiss what I'm about to say. But I've used this line in the past. I tried to really pick the situations and circumstances, and you'll see why. Not so easy now since COVID and everything that we do is virtual, less and less one-on-one with patients or with patients and their spouse. But here's my little story. So again, because of our demographics, THC, there's some concerns, and we talk about CBD, where CBD will help tone down the potential effects of euphoria and psychoactivity, and really, have that impact. And I said, similar to a husband and wife. And then they look at me. And again, I picked those that I feel I can share that with based on a little bit of a relationship built up over the previous 5 minutes or so. And they look at me with that question in their eyes. I said, yeah, I said, if your husband is going fishing with the boys for the weekend, likely to behave slightly differently than when at home with his spouse. And they both chuckle because they get it. So I said, similarly, the female or the wife being the CBD component and the guy being the THC on its own will behave a little differently. But if you put both together, it tones it down and they get a chuckle. But more importantly is that they remember that scenario when they're talking about, some kind of a blend of CBD and THC. That's my humor for today, Paul.
It's a great analogy. You know what? We spend a lot of time giving those because when you're just talking letters or science terms or whatever, it's easy to forget. That's a hard one to forget. I really like it. And thank you for sharing with everyone listening and viewing today.
Yeah, and Paul, I have no copyright on that, so feel free to use it anytime that you feel so inclined, and the same applies to our listeners.
One thing I did want to touch on with this intoxication, euphoria, is sometimes it can be more paranoia. And in all honesty, we talk a lot to our clients about safe use. And it's a little difficult if you live on your own. But if you're with someone else when you're dosing, when you're medicating, and this happens to you, it will pass. The simplest way is it will pass, and that depends on how you consumed it. And so having someone there that can talk you through it, whatever it is, if you're having visual effects or whatever, talk you through it. It's not real. If possible, lay yourself down and try to calm yourself down as much as possible. But, it's not an overdose in the sense of where we see in the media opiates, where you'll just stop breathing, as the case may be. This is unpleasant. It can feel like death, but you're not dying. And so it's just a matter of time passing. I think that's important to bring up to the listeners, because people do have adverse, or we'll say more severe effects.
I would agree, Paul. It's usually important to bring it up, and it's making individuals aware so that if they do find themselves in that situation or someone in their presence, that first of all, don't panic as a result of that. And that's a huge, huge plus already. And knowing that it's not critical and that it will pass. So the more that you can do for yourself, just to calm yourself, or for yourself to do that for someone else, you're already better positioned to be able to do that, having the knowledge that you just shared, Paul. I agree.
And just to continue that one more step, insofar as overconsumption goes, THC edibles. And edibles are kind of the new kid on the block, certainly in Canada in a legal sense. We're a little more than a year old from Cannabis 2.0, where we have the edible products. So the thing with edibles and their packaging and the types of contents that they're infused with, when we talk brownies or cookies or drinks or whatever, they don't, not that they need to be putting in fear to people, but they look like harmless. It's a cookie. It's a brownie. And I think that might play into people's minds to some degree right at the start, before you even consumed it. This is something fun, if you will. And so there's that. But the edibles are a long onset of action. So onset of action is fancy terminology for once the cookie or the edible goes into your mouth, it needs to go down into your belly through the liver. That processing, depending on what's in your belly, who you are, your genetics, but a lot of factors, can take upwards of 2 to 4 hours. And what stats have shown, or especially in places where cannabis has been legal for a longer period of time, so you can find stats on this, like for Colorado as an example, is there's an inordinate amount of emergency room visits for cannabis overconsumption. And it's not the first brownie or it's the first cookie. It's the person who doesn't feel an effect in 2 hours that's sitting at their party or wherever, and looking around, and maybe the people around them are feeling something. They're not. The point is they're not feeling anything. Well, maybe I didn't take enough. And lo and behold, you go to take the second brownie, and the first one now is kicking in, and well, the second one's already in your belly, so it's going to kick in, and so you have overconsumption that way, and you can get some more of the, we'll say, psychosis effects, like really bad, where it does result in emergency room visits. The people around you don't know how to deal with it, and stuff like that, and that is. Really, one caution to, edibles consumed the right way can be a way to consume your medicine, but there is a potential for overconsumption, especially when you're not patient enough to wait for the effects of the THC to start taking hold.
Yeah, exactly, Paul. Very good point. And as you're speaking that, something came to mind that I think is worthy of sharing as well, is from a safety aspect. So to use your example, it can take up to 2 hours. So you're at a social somewhere, someone offers you a brownie or some form of edible with some THC in it, and you consume it. You're feeling zero effect. And, maybe the phone rings and you got to leave, or it was already your plan to leave earlier. So now you get into your vehicle behind your wheel, not feeling any effects. And those effects can take place, while you're in your vehicle and now driving somewhere. So I just wanted to throw that out there as a caution to those, especially those who are fairly new at this and don't really understand what we just say. I'm hoping that this example will really stick with them, because that they can get a visual from that and all of the negative things that could result, because of that.
Yeah, it's an excellent visual, Mark. For the people keeping score of times, if you will, that are listening, this can take upwards of 8, 10, sometimes 12 hours to run through your system. So once the effects start taking place, you're in it for the long haul. And so it's a very fair point once you get in your car feeling okay, but there's going to be a long period of time you shouldn't even consider. So if we use, more of a recreational scenario like we just talked about, where you're at a part, if you're using a cannabis edible, you're not driving home that night, or you got your taxi or your friend or whatever, someone not impaired.
Paul, as you're speaking again, another visual came to mind, and that is, going to a social, and part of what they're consuming is a joint or weed that's been cigarette type, which is very, very common. And that could be, I'll call it, alarming to someone walking in who's fairly naive, okay, and make a decision of saying, I don't think that's for me, right? Where a subtle, innocent looking, maybe even eye appealing, gummy bear or brownie, especially like me, if you have a sweet tooth, you might be more inclined to try that. So again, I just want to get that message out there. We're not saying it's bad, it's evil. We're just saying beware of the potential risks associated with that.
Yeah, for sure. And, for people that have been following along with us, the Mad Canada episode, we touched a lot on this, and there were some excellent pointers there as well. We've kind of gone a little different today as opposed to medication and stuff like that. We're talking a little bit about recreation use, but this, of course, whether onset of action or how long it lasts, or driving your car, this is to the person medicating as well. We've kind of painted a different scenario, but for this person in we'll say using it in a medical sense as dosing, we talked about using it at night for a sleep aid, insomnia. If you're using it at 11 o'clock because you're going to bed at 12, but you need to get up and go to work at 7, you still might feel the latent effects. So it does relate to cannabis dosing, we'll say in a medical sense as well as a recreation sense. And we've had clients of ours where we've had to adjust dosing to earlier in the evening so you don't feel those latent effects. Not unlike, with the ride programs looking for excessive alcohol intake the night before. They're out in the mornings looking for that. It would apply the same way with the THC if you haven't allotted enough time to let it run out of your system so you're not impaired as you're going to work or what have you.
I totally agree, Paul. Anything else on your list? Is this time for closing comments? You're the driver here.
I'm just trying to keep up. No, all kidding aside, there's a point. Maybe you can share a little bit more. There's a point in our previous patient manual on overconsumption, and there's a little blurb about peppercorns and citrus and chomping on peppercorns or citrus. Are you familiar with that at all?
I've heard of that, and when I heard it, I'm like, okay, that may make sense. And I believe to some degree there is effect from that. Depending on where you're at, then I start to wonder just how much caffeine or peppercorn do you really need to consume to be able to really have an impact. Again, it's proportionate to how much have you consumed of cannabis and where you're at to see how effective this is. But, I'm really not an expert in that area.
No.
But what I've heard is that to some moderate degree, it's certainly not going to harm you. And there's a risk, or not a risk, a chance rather, that it will help. But I think overall, you touched on it initially, stay calm.
Yeah.
If you can lie down and go to sleep, that's probably your best defense against that, because really it's time. It needs to go through, in time.
Yeah. So just to tie it all together, because I kind of, you know what I'm speaking of, Mark, but maybe not all our listeners. It was just ideas that reduce, we'll say, an excessive high once you've consumed some THC. And the idea, or the things that we've heard, is the chewing of the peppercorns or the citrus, taking in the citrus as a reduction of the excessive high feelings. I tend to agree with you, Mark, because we know we can help, or we know, first off, we can control our panic or that internally. It might not feel like it at the time, but we can do that, and those around us can help with that. And I think I agree with you wholeheartedly. Those are your go-to mechanisms if you feel like it's going off the rails a little bit.
Mm-hmm.
As far as THC, I think we've hit a lot of points today. Another nice discussion, some stories on how THC has evolved over time, and how consumers of cannabis are looking at it differently and trying to fit it into their treatment plans with their lives as the way they are. All positive changes. I'll leave it to you for if you have anything to add, or you you want to wrap it up?
Well, since you've opened this up earlier, fairly early in the conversation, so I'm pushing 65, and I did live through kind of the tail end of that era. And as I say in my introduction, it wasn't for me, and I did, have judgment against those that were consuming, not recognizing the medical benefits. So I spent a better part of my life with those thoughts until I discovered differently, right? So for those of you in similar age group, I just want to say that this stigma, it was there because of really misuse in some cases, and abuse in other cases, but it wasn't all of that. There were some that were using it for legitimately for medicinal purposes, and it was helping them with their condition. So if you're one of those that, when you hear even the term marijuana, that you kind of cringe a little inside, I would just say lighten up a little bit. It's really not bad, especially today, the way it is utilized under the supervision of medical professionals and combining it with CBD and those sorts of things. There is truly an appropriate place for it in a treatment plan. And we can give you countless examples of that, right, Paul?
Well said, Mark. Yeah, I think it's a positive evolution to things, and it can only go forward from here as honestly, more research is able to be done, and the way that happens is as more and more areas are able to go through the process of legalizing. This enables other companies to do the research on the things much more easily. Is what it is. In areas where it's illegal, it's hard to do the research, and this would be the best thing across the board, because then you would know. A lot of what we have is anecdotal, is experience to the 6,000 patients that we've seen. But it would be really nice to point to this study or that study or whatnot, and hopefully we get there soon. That would be great.
And I'm sure we will. When I look back, Paul, the evolution in the space, and I know we haven't reached, the peak even. It's still a ways down the road, and it's probably going to be ongoing evolution. And I really look with anticipation where this is really going to go. We talked to some patients that are really keen on terpenes, and that they can tell the difference between one and the other, where others would not. So there's so many different aspects, and I believe areas, and the method of ingestion now too, or inhalation, sublingual, the sprays, all of those things. It's going to continue to evolve, and I think for really the betterment of helping those people find a alternative to some of the opioids that are on, and being able to get closer to their own respective goals towards wellness and being able to have an improved quality of life. Paul, closing comments from you.
I think you can wrap up, Mark. That was an excellent point. We're on the cusp of things. I tend to agree with you, and hopefully we start seeing some things soon. So thank you.
So Paul, as always, it's been a pleasure, and trusting that those listening live today, or those that will listen to our podcast, will agree that there was some valuable information that was shared here today, and we look forward to seeing you next time. So on behalf of Paul, myself, and those behind the cameras that help us, make this happen, and to all of our listeners, we say thank you. And until the next time that we are in touch, we say, be well. Thank you for joining me. I'd like to take this time to share with you how I first became interested and then involved with cannabis as a medicine. My name is Mark Trombley, a founding member of Simcoe Holistic Health, Ontario's first medical clinic dedicated to the treatment and care of those patients considering cannabis as an option. As a teenager, I did sample marijuana and quickly concluded that it simply wasn't for me. I'll admit I did find myself judging those who did consume weed, thinking that their sole motive was strictly to get high. It wasn't until many years later that I discovered the true medical benefits of marijuana. A loved one was diagnosed with MS. After many months of symptom manifestation resulting in sleepless nights, I witnessed firsthand how cannabis can help alleviate symptoms and improve sleep. My eyes were open. My interest further increased. As a result, Simcoe Holistic Health opened its doors in 2013. Since then, our clinic has operated under 4 Health Canada regulations and served nearly 6,000 patients, ranging from ages 3 to 93. I have personally witnessed countless individuals and families who experience improved quality of life. Having said that, I've also observed that cannabis treatment is simply not for everyone. As we continue to grow and expand our reach, Simcoe Holistic Health is rebranding to Weedwell. For more information, visit us at weedwell.com or follow us on our social channels. Till the next time, be well.